Hi, my name is Selina. Today I'll be presenting this topic, which is written by Sally Drake. It's called Biological Therapies for Rheumatoid Arthritis. One of the therapies is known as the disease-modifying anti-rheumatic drugs, or short form as DMARDs. Basically, it reduces joint inflammation, it prevents joint damage. So it comes in as a conventional, such as methotrexate, and the second type is biological, which we're going to talk about more right now. The biological DMARDs include Torcept, adalimumab, certolizumab, Pegol, EternalSept, golimumab, FlexiMap, Torcept. The therapeutic guidelines consider these agents to be equally efficacious. How do we handle this? So we have to store it in the fridge. Make sure it's packed in its original package to protect from light. Avoid shaking it. For traceability, it's recommended to record the brand and the batch number in the patient file that we're using. Okay, the first type is TNF Alpha Inhibitors, or known as tumor necrosis factor alpha. Includes adalimumab, certolizumab, Torcept, golimumab, and FlexiMap. Clinical benefit may take a few weeks up to 3 months required for full clinical benefit. Adalimumab. It's comes in as pre-filled syringes and pens. The usual adult dose is 40 milligrams subcutaneous every 2 weeks. For patients who are not taking methotrexate, they may consider a different dose, which is 40 milligrams weekly or 80 milligrams fortnightly. Certolizumab. Certolizumab is a pegylated product. Pegylation delays the elimination of certolizumab, hence it extends its half-life. It comes in as a pre-filled syringes and pens. The usual dose would be 400 milligrams subcut at weeks 0, 2, and 4. Then 200 milligrams every 2 weeks, or 400 milligrams every 4 weeks. It's only available in 200 milligrams. EternalSept comes in the vials as a powder form. The dose is 25 milligrams. So you actually reconstitute it with 1 ml water for injection. You inject the diluent into the vial slowly and swirl gently. Comes in also as a pre-filled syringes and pens. Strength is 50 milligrams. It's ready to use. Just remember to remove from the fridge at least half an hour before using it to reduce pain. Golimumab It comes in as a prefilled syringes and pens. The strengths are 50 milligrams in 0.5 mils or 100 milligrams in 1 mil. Usual dose is 50 milligrams subcutaneous monthly. For infliximab, it's commonly prescribed with methotrexate. It comes in a prefilled syringe and pen for subcutaneous injection in 120 milligrams in 1 mil. Also comes in a vial of 100 milligrams for IV infusion. So you actually constitute it with 10 mils water for injection. You swirl gently to dissolve it. Then after that, you dilute it with 0.9% of sodium chloride to a volume of 250 mils. The usual intravenous dose is 3 milligrams per kilograms at weeks 0, 2, and 6. Then every 8 weeks. So you infuse it over a period of 2 hours. For the subcut dose would be 120 milligrams weekly for 5 doses, then every 2 weeks. Common adverse effects are infections, including opportunistic infections, injection site reactions, rash and itch, headache, production of autoantibodies. It also has effects on comorbidities. It may increase the disease activity in demyelinating disorders such as multiple sclerosis. It also may worsen heart failure. About Torcept. It is a selective co-stimulation modulator. How it works is that it binds to CD80 and CD86 on antigen-presenting cells, blocking their interaction with CD28 on T cells. So basically what it does, it inhibits the T cell activation, reducing the cytokine production and inflammation. So can be used as IV infusion, 500 milligrams to 1 grams over half an hour. So you repeat this at weeks 2 and 4, and then every 4 weeks. So it can be used as subcut injection. So dose is 125 milligrams weekly. Tocilizumab. How it works is that it reduces IL-6 mediated inflammation. Can be used as IV infusion. The dose would be 8 milligrams per kilograms over 1 hour every 4 weeks. Comes in a vial of 80 milligrams in 4 mils, or 200 milligrams in 10 mils, or 400 milligrams in 20 mils. So you dilute the vial in 0.9% sodium chloride, and then you gently invert the bag to mix it. For subcut injection, the dose is 162 milligrams weekly. You're allowed to reach room temperature before use. The side effects is similar to the TNF Alpha Inhibitors. It also may be associated with gastrointestinal perforation. So, what are the alternative therapy if someone has failed to respond to the first-line treatment. Rituximab is the second-line option. Basically, it binds to CD20 on B cells. The course is 2 doses of 1 gram. It's an IV infusion, and it's given 2 weeks apart. And then it may be repeated again after 6 to 12 months. For pre-medication, normally they are given an analgesic, antihistamine, and glucocorticoid. Infections, it increases the risk of infections. It should not be initiated in patients with serious or untreated infection. Consider the risk of post-operative infection for surgical patients. Avoid combination with other immunosuppressants. There are strategies to reduce infection risk. So the first one, we may have infection control measures, antimicrobial prophylaxis, and vaccination. For antimicrobial prophylaxis, doctor may prescribe pneumocystis gyrovecii pneumonia, PJP prophylaxis. Drugs is trimethoprim with sulfamethoxazole. In patients who have latent tuberculosis or inactive hepatitis B also are given the antimicrobial prophylaxis. These people, while you're on this drug, should not be given the live vaccines such as the BCG, the Japanese encephalitis virus vaccine, the MMR vaccine, oral typhoid vaccine, the varicella vaccine, yellow fever vaccine, zoster vaccine. Inactivated vaccines can be safely used, however, efficacy may be reduced. Vaccines are routinely recommended in immunocompromised patients. So it's good to have influenza vaccine done annually, pneumococcal vaccine, meningococcal vaccine, HPV vaccine, hepatitis B vaccine, and recombinant zoster vaccine. Sometimes dose reduction may be considered to reduce the adverse effects. However, best strategy is not known. Doctor may reduce the dose, may increase the interval between doses. Discontinuation also may be viable in select patients. So in summary, adalimumab is given as subcut every 2 weeks, certolizumab given as subcut every 2 to 4 weeks, EternalSept given as subcut weekly or twice a week, golimumab is given as subcut monthly, FlexiMap given as IV every 8 weeks or subcut every 2 weeks, Torcept given as subcut weekly or as IV every 4 weeks, tocilizumab subcut weekly or IV every 4 weeks, and rituximab given as IV with 2 doses 2 weeks apart. All right, question 1. Which of the following medications is typically reserved for use in patients who have failed to respond to first-line biologicals for rheumatoid arthritis? A. Certolizumab, Pegol, Abatacept, or rituximab, or adalimumab. Question 2. What is the usual recommended timing for receiving live vaccines in patients on biological DMARDs? A. At any time during therapy. B. At least 1 month before the first dose. C. At least 12 months after the last dose. D. B and C. Question 3. General instructions for handling biological DMARDs include A. Keep refrigerated. Shake vigorously to ensure the solution is well mixed. C. Protect from light. D. A and C. Answer for question 1 is rituximab. Answer 2 is D. The answer for number 3 is D. Thank you.